Hi, listeners and viewers, and welcome to another episode of Illuminating Mind Matters with BASANT Now. Please find us online at basantnow.org. I am Shalini Dayal. I'm a marriage and family therapist, and I'm your host today. Our topic for today is neuropsychological testing. And with me, I'm very honored to have Dr. Netu Hans on our show today. She's a clinical psychologist with a specialization in neuropsychology. She has worked with children and adults in settings such as Children's Hospital in Oakland, San Francisco General Hospital, VA Palo Alto, and St. Mary's Medical Center. She strives to predict how brain injury or developmental challenges impact a person's daily life. She has a private practice in Fremont where she conducts assessments with children and adults with ADHD, learning disabilities, and brain injury, and also works with lawyers to provide neuropsychological evaluations in personal injury cases and immigration cases. And she also tests for autism, along with other testing as well. She works currently with the Wright Institute as well, teaching students, and is in their training program in the Contra Costa County Regional Medical Center. She speaks Hindi and Punjabi and has participated in numerous educational talks held at ICC. So, Neetu, thank you and welcome today. And thank you for taking time off from your very busy schedule and talking to us about neuropsychological testing. And we are hoping to today address what exactly is neuropsych testing and how do people go around assessing those services and accessing those services. So, my opening question is actually that how do you see and understand neuropsychological testing versus psychological testing?
First of all, thank you so much for having me. And so I want to start out by saying, yes, neuropsychological testing is not something that is very commonly heard of within our community.
Mhm.
And neuropsychological testing is often something that physicians might refer you for, or
Mhm.
the school might refer children for, and it covers a variety of things. So usually, when you come in for neuropsych testing, it's something that you are working with a psychologist on, and the psychologist is trained, should definitely be trained in neuropsychological evaluations. So there's a whole process that psychologists have to go through to be trained in that process, and what they the training emphasizes being able to learn about brain and behavior and the
Mm.
intersection of brain and behavior. So they are able to look at different aspects of functioning of the brain and then predict how that's impacting your everyday behaviors. So when you come in for a neuropsychological testing, what you're going to expect is it is going to be a long process. It's
Mhm.
not something that is short. It's not something that, like a blood test where you go in and you're in and out in 15 minutes. It requires you to be there at least for 2 hours, if not longer, depending on the question. So typically, the psychologist first will go over the history with you, will go over getting the background information on what issues you're having. And then they'll ask you to participate in some paper and pencil tests. And these are standardized tests that are used to compare people of a similar background, similar population, education, and based on that, then the results indicate whether you're having difficulties in certain areas. So typically, neuropsychological assessments at once the assessment is done, the psychologist is going to prepare a report and have recommendations for you, and those recommendations is something that they will discuss with you and see how they can help you in maximizing your everyday functioning, and also try to reduce any barriers that you're having. So those are some things that you should expect when you go in for a neuropsychological evaluation.
Thank you for explaining that, especially what is the process, what to expect when the person first comes in, walks into your office, and what the process goes like. How does one access neuropsych testing? And instances like through schools or through the insurance companies. Can you speak a little bit about that?
Yes, absolutely. So, like I said before, neuropsychological evaluations can be held for a different variety of reasons. And so, there is a different settings where you will find neuropsychologists. So, for example, if you're an adult and you've been in a accident where you had a brain injury, or you're finding that there is some concussion or effects, cognitive effects that are impacting your memory, then there might be a neuropsychologist on staff in the hospital that conducts an initial evaluation to see what the results are, where you're having difficulty. And typically, then there are some follow up evaluations that are done. Whereas if you're a child and say you're having learning problems, so a child might be very bright, but maybe they're having difficulty learning one subject, say they're weak in math, and that's causing them not to have academic success, then the school can also do an evaluation. But if sometimes, if the school doesn't have the resources, you can ask for an outside evaluation as well. And so the neuropsychologist can do an academic and a behavioral assessment to see what might be causing some of the problems that the child is having in school that are interfering with the child's academic achievement. And then, based on that, the neuropsychologist can work with your school, attend what are called IEP meetings, and help the school implement some of the strategies that might be helpful for the child. Similarly, if you're having trouble at work, and say you have an undiagnosed ADHD and you're an adult and you're not able to progress in work, then you can come in for an evaluation. Now, as an adult, typically most insurance companies do cover neuropsychological evaluations, and most of them do not require authorization anymore. They used to in the past, they don't anymore. But there are some companies that still require authorization. And typically, if I'm seeing someone through insurance, then I will ask for what's called a pre certification and to make sure that that's covered. But if the person is out of network, you can still, and you have a PPO plan, you can still go to the neuropsychologist and they will do the evaluation for you and give you what's called a super bill, and then you can submit that to your insurance, and depending upon your benefits, they will reimburse you. If you are going through insurance, I would highly recommend getting a referral from
Mhm.
your either a psychiatrist or a primary practitioner, because they can discuss with you what the benefits of neuropsych testing can be, and also give you that referral, which will help you see whether it's medically necessary. So that's through insurance, I would say that would be the best route to take. Now, you can always initiate a referral on your own as well. So if you're feeling like there is some issue coming up and you can pay out of pocket, and typically, if the psychologist gives you a bill, you can submit that to your HSA plan as well.
Thank you for explaining that in so much detail. And I'm hoping that our viewers and listeners are actually now more knowledgeable about this process, that this can be accessed from many different ways. Because often there are some barriers when the insurance companies don't cover it, or you need a referral, and the clinicians or the practitioners are not always convinced and don't provide those. There are alternatives
Yeah.
that for people to get the testing done. How do you approach confidentiality in your process?
So confidentiality, I consider that to be really, really important.
Mm-hmm.
For example, in my office or even where I work outside in an outpatient clinic, we follow all state and federal guidelines that are set out by HIPAA. So we make sure we're keeping all patient information confidential.
Mm-hmm.
And it is a top priority that we keep all records under lock and key, that they're not given out without the patient's permission. I always make sure that if there is a request for records, say I'm working with a patient and they apply for workers' compensation, I will call the patient to confirm with them to make sure I can release the documentation. So I try to have that constant communication about release of any information. If I have to talk to a family member, I will get a release signed from the patient
Mm-hmm.
and discuss what are the things that I can talk to the family member about, whether I can disclose information to them, or should I only be getting information. So I try to make that very clear and have you sign a form before I talk to any family member. So, like I said, I think confidentiality is very important. It is something when I initially started working, that was something that was a big issue coming up within our Indian community.
Mm-hmm.
And for me, I always feel like that is something I want to prioritize and make sure
Mm-hmm.
I'm keeping
Mm-hmm.
information confidential.
Mm-hmm. That is good to know. And that this is confidential unless they give permission to be released to certain areas. Because I do want to talk a little bit about, if we do have time, about how IEPs work and how testing is so valuable for the individualized education plan for kids and for adults who need accommodations even at work. So I hope we do have time. I do want to, before we get there, I do want to talk a little bit about autism, because I know you're one of the very rare psychologists in the area who tests for autism, and that is very wonderful, and because it's such a valuable service for our community. Can you speak a little bit about your process for testing for autism and some of the barriers that you experience when you're testing for children and adults?
Yes. In general, let me address the barriers issue
Hmm.
first. So, in
Okay.
general, I find, a lot of people don't know about neuropsychological evaluations. So, that's definitely a big barrier, right? The second thing is that within our community, often we're very reluctant to address issues that have to do with mental health or with psychological problems. So, I would encourage people that definitely seek help. Your mind is just like your body, it's part of our whole body. And just like you would treat any physical illness, our brain is also a physical part of our body, and we want to make sure we're treating it. So it's very important to address those issues as quickly as we can, and especially with something like autism. So my interest in autism actually started because I started seeing a lot of adults who were having difficulty at work, or were not progressing. I did some training, and I now understand that often sometimes these issues are happening because of autism. And even though autism is diagnosed early in childhood, I think that speaks to the range of autism that we see. And so, initially, to talk about autism, autism is a developmental disorder. So, typically, we will see that in early childhood. But because autism has so many different levels, so we might not actually diagnose it in a child when they're before the age of 5. We tend to see more severe cases of autism diagnosed before, but children who are able to compensate or don't have very severe deficits, they often don't get diagnosed. So when we talk about autism, autism is something that has three aspects to it. So when you're diagnosing autism, you're not just looking at repetitive behaviors, or looking at a child who might not want to socialize. You have to look at the whole picture. And so you're looking at whether a child has, firstly, deficits in social interaction, which means that are they able to make friendships? And are they able to maintain those friendships, right? Even within the household, are they able to express their social needs? Are they able to understand social needs? So it has to be in both those directions. It can't just be in one direction. And often, children with autism want to make friends. It's not something, I think it's a myth to think about that children with autism are not interested in social interactions or developing friendships. They do want to do that, but because of some problems with interaction and knowing how to interact and navigate that social behavior, that's where they're having more difficulty. The second thing we're looking at when we're diagnosing autism is whether they have any deficits in verbal or nonverbal communication. So, can they express their desire of what they want or what they need? And can they understand when other people are talking to them a certain way? Do they understand tones? Are they able to pick up on meanings that of things? Often in our communication we talk about things in a way that is very dependent on how what our facial expression is or how we're using nonverbal behaviors. And can the child understand all of that? Because if they can't, then that counts as a deficit. And the last thing is that often with children with autism, we're seeing either they have a very restricted interest, so they want to talk about only one thing and they're not able to talk about other things, or they don't enjoy talking about other things. And then also they might have some repetitive movements. Very commonly, we'll see some flapping, or it can be a certain picking movement, or sometimes it's how they want to arrange things or do things in a in a specific sequence. So those are some of the criteria for autism, and the child has to meet all those criteria in order to be diagnosed. Now, there are, like I said, different levels of autism. Earlier, we used to have autism, and then we had something called Asperger's. Now, we just have autism
Mhm,
spectrum disorders, and that's
mhm,
recognizing that it is a spectrum. And so
mhm.
there's a lot of variability. And so somebody can have mild autism where they don't need as much support and they're able to function pretty independently on their own. Where also somebody can have moderate deficits, and that means that they might need some support. So, for example, maybe they need an IEP and they need maybe extra help in the classroom or extra time, but they might not need a lot of extra support beyond that. And then there's the severe form where you might need more supports from the community. You might get some help from the regional center. So those are some of the different levels of autism. And sorry, and last thing that I want to say about that is that with autism, it's very important to get timely intervention and early intervention. We've seen good results from that. And so if it's diagnosed early on and the child gets a lot of intervention with social communication and ability to be able to modulate some of the behaviors, then we see very good results.
That was very informative. I actually took notes. I was like, this is such a great way that you explained to me and hopefully to our listeners and our viewers as well, because I would like to explain that to my clients as well, because this was really, really well explained and I really enjoyed it. So thank you.
Okay.
Uh, can you speak a little bit about the myths and perceptions around autism, from especially with focus on the South Asian community? What are your experiences?
Yes. So, the first thing is I see is that our community is not very familiar with this diagnosis. So initially, when a child might show some autistic symptoms, we're very likely to say, oh, it's nothing. Let's just try and ignore it, or it'll go away as they get older. But I would say, if you find that the child is having difficulty in forming friendships, if the child is having problems with adjustment, because at the end, any mental health disorder has to do with adjustment in the community. So if they're having trouble with that, keep in mind that early intervention is very important. The common myth I see is that, firstly, people, are not getting vaccinations because they think that, oh, if we get a vaccination, our child is going to get autism, and that is definitely been debunked. It's not true. It's very important to get those vaccinations, and there's no evidence to suggest that vaccinations cause autism. The second thing that I see, is that often parents blame themselves, that I must have done something, or it was my behavior, or I was very stressed during the pregnancy and that caused my child to be autism. And while we don't know the exact cause for autism, there is growing evidence to show that often it's genetic. It might be related to, just like any other developmental disorders, it's related to older age in parents, or there might be other factors that contribute, but it's usually not got to do with a parent, or a specific behavior of a parent. And often, especially mothers will really put
Mhm.
themselves down when a child is diagnosed with autism, and it's very important to remember that it's not your fault. So that's the other myth that we see. And then I would say one more thing is that often when people see that a child's doing repetitive behaviors, they'll think, oh, it's autism. But remember, it's not just one thing, it has to be all these different things together.
That is good to know. And you're absolutely right on about how parents blame themselves, especially mothers. There's also like a great growing information, a body of knowledge and information around having autism versus being autistic. It's people are saying this is a way of being, and it's not an illness that can be cured. Because I do hear a lot of families say, how is my child going to be over it? And are they cured now? Can you speak a little bit about that?
That's an excellent point and a very good question. I think there's a lot more awareness about
Hmm.
neurotypical versus neurodiverse individuals. And what that means is that, neurotypical individuals are generally individuals who fit into the world well, so they can follow social norms, they are able to adapt to situations. Whereas for neurodiverse individuals, which is what autistic individuals would fall under, they have a little more difficulty with following social norms and being able to figure out what's expected of them in social situations. And so they don't fit in as well. But I think it's up to us neurotypical individuals to recognize that each person is an individual. And you're right that autism is not a disease that you can give some medication and it'll go away. It's really helping not only the autistic individual adapt to the social environment, but also the neurotypical individuals to respect each person as individuals and adapt to them as well. So I think
Excellent point.
yes.
Thank you
So
for saying that. Thank you for saying that very, very much. And some takeaways. What are some takeaways and wisdom that you would like to share with our listeners and viewers on your experiences in the neuropsych field and in testing and helping people and families with autism? What would you like to say to them?
yes, no, I mean, I think, in general, getting a neuropsych evaluation can help you in many different ways. So, if your doctor recommends it, if it's something that's going to be helpful for you, I would say don't hesitate, because it gives you a good picture of what your strengths are, what your weaknesses are, and the recommendations are really tailored towards helping you be successful in whatever
Hmm.
area you're in. So, it's very helpful. And then the second thing with autism is that I would say recognize that it's a way of being, support it, and make sure you're not treating it like it's a stigma. It's, everybody has different ways of being, and that's just one way of being. And so, That's helpful.
Thank you. Thank you so much. And this is very valuable. Your insight and I can see the depth of your knowledge and experience showing here. So thank you so much for sharing your time and your knowledge with us. And hopefully our listeners and viewers are also helped, it will help them understand what neuropsych testing is and also a little bit about autism. And I would like to remind our listeners and viewers that we have another show planned next week on more topics relating to our mind and to wellness. And if you are interested in suggesting topics, please reach out to us at info@basantnow.org or visit us at basantnow.org. And with that, thank you, Netu. Thank you very much. And of course, I do want to remind listeners that your information is listed on our website, basantnow.org. And so if viewers would like to reach out to you for an consultation or for testing, they can do so. So
Yes.
thank you.
Thank you for having me.
You're welcome.